Okay, we've come together to work on our joint control, and it's exactly that. So let go of everything that's in your mind except for your body. We're working slowly. We're keeping pain to under 5 out of 10. So 5 out of 10 would be moderately uncomfortable, where you are going to have difficulty focusing for more than a few minutes because the pain is starting to interfere. So just be aware of that pain score. If pain becomes into the 5, that you make the motion smaller, or you stop at that point, or perhaps you even check the quality of your movement. So we're really focusing in on our positioning for this next 30 minutes. Let's go. You need a chair. That is a firm chair. I have a stool with a cushion, and you need your band in a loop. Alrighty, so getting the foot, both feet through your band. Maybe not in standing, but in sitting. And let's spend some quality time on our body. So down to the floor, taking one large step back, maybe hands on the chair, so the knee is stacked over the ankle. Down onto our backs, and we'll begin with our bridges. So for this week, our feet are close to our buttocks. The band is around our knees. We're pulling out just a comfortable distance against some tension. Remember to drive down into the heels first, so you feel the glutes are on. Then push up the hips and the pubic bone. Hands are placed on the front of the hips, so we're mindful of pressing the hips up into the palms and fingertips. And down we go. Relax the knees. Knees out. Press into the heels, feeling the glutes on first, then left. And as we keep the hips pressing up into the palms, we want our back and our tummy and our ribs to fall slightly. And down to the floor, relax the knees. Knees out, heels press, push up, hips up into hands, low back and ribs falling slightly, dropping the bum down, knees relax. Pulling out, we're starting to feel the muscles on the side of the hip now, pressing down into the heels, holding the hips up into the palms, letting the back and the tummy fall to the floor, and down we go and relax. Now this time, see if you can pull out just a little further against your band. Press into the heels, keeping the knees out that distance as we push the hips up. Now, if you're not sure if you're using your back too much, because we don't want a curve in the back, see if you can get your hand behind there. Make sure that your back is not pushed up, the tummy up, but really letting tummy and ribs fall. Down we go and relax. Pulling out that little bit extra distance, pressed into the heels, then lift up, keeping the knees out that extra little bit if you're able. We don't want any groin pain. Down to the floor and relax. Should you feel groin pain, lessen the pull. Pulling out, pressing to the heels. Up come the hips into the palms and fingertips, the low back, tummy and ribs falling to the floor. Down we go, relax. Last one, out we pull, press through the heels, up. So now you can feel this in the back of your buttocks, the back side and the sides. You should feel it in there. Not to have any cramps in the hamstring, not to have any tension on the low back, and down and relax. Super job. We're going to roll over. And actually just bring the band up to your hips. We'll just get it out of the way. We're going to use that in a few minutes again. So just get that out of your way. Rolling over now onto our elbows. Now you can do a plank on the floor on your elbows, but I'm going to show you on the chair first. Actually, we did begin this week on the chair. So grabbing your firm chair now, pause the video if you need. Elbows are on that chair. They are under your shoulder, never ahead of your shoulder. Elbows under shoulder, one leg is back. Now we're really drawing in the tummy as if we're taking a punch to the tummy. Second leg is back now. Keeping the buttocks squeezed helps to straighten the hip. Squeeze the buttocks, press down into your elbows, keeping that tummy tension, which pulls the belly button and the ribs up to the spine. So we're trying to avoid the bum going up and the tummy going down. We want to get the tailbone under, which is the squeeze of the buttocks, and the tummy tension, like you're taking a punch, helps to pull the tummy up toward the spine. Okay, we're going to bring one knee down to the floor and the other and take a rest. If you can't get two knees back and your wrists are okay to be on your wrists, then what I would do is come into this position for the next repetition of this, and I'll demonstrate in that position. Okay, everything's wiggled out. We're ready to go for the second repeat. So whether you're on your elbows, as we just did, or on your palms, one leg is back, press firmly through your palms or elbows, tension into the tummy like you're taking a punch, then your second leg goes back. Squeezing the buttocks, making sure that the buttocks is not out and the tummy sagging, squeezing the buttocks to tuck the tailbone under as we squeeze the glutes. Tummy tension, like we're taking a punch, pulls the belly button and the lower ribs up toward your spine, pressing down into the palms, always keeping arms under shoulders. Now let's take a big breath in here. Breathe it all the way out. Keep squeezing through the glutes, holding that tummy tension. One more big breath in. Breathe it all the way out. And we'll bring one leg forward or put the one knee down. All right, well done. And again, if pain score is up into 5, you don't hold your position as long, but always check your positioning as I'm cueing you with my words. Okay, we're going to get rid of this. Back down onto our side. If you need the chair to get down, hands on the chair. Big step back. Knee is stacked over the ankle. Down to our left side, and we'll get this band over the knees again. Now into our clams. The knees must not come together. That's very hard and compressive on the joint. So we're going to start with some space between them, and we won't bring them together at all through the motion. Okay, hand is on the front, right hand is on the front of your right hip. You're on your left side. Your knees are not too far forward. We're going to keep the feet together, specifically the heels. Okay, pulling up the knee for 3 seconds. Right hip is into your right hand. Now down about halfway, 3/4 with the knee. Pull the knee up, keeping your right hip into the palm, feeling lots of work in that right buttocks, and down halfway. And as we pull the knee up, it's all at the hip joint, trying to not roll on your weight-bearing hip. Down we go with that right knee. Pulling up, number 4, counting to 1, 2, 3, and down halfway. Keeping very steady on that left hip as we lift the right knee. Right hip is into your right palm, and down, and up. As high as you can get the knee. No groin pain, no inner thigh pain. Should that be the case, don't pull up so hard. And down halfway. The other thing you can play around with if you're feeling groin pain as we lift the knee again is maybe your tension of your band is too much. Lessen the tension. We want to make this easy movement, but allowing the knee to get as high as we can without rolling back. And down with that knee. 2 more. Up we come, keeping steady on the left hip. Right hip is forward. Down. And it is a small motion, when we isolate it just at the hip. When it becomes a big motion, we're rolling. So just keep that in mind. All right, we're going to flip to the other side. Making sure again that your knees are slightly apart and not too far forward. Heels stay together. Left hand on the front of your left hip. Making sure you're steady on your right hip. Here we go to lift, left knee up, 1, 2, 3, and down halfway. Lifting up. Again, if there's growing pain, don't go so high. If you find that just for the moment, you might want to move the band a little bit up the thigh to reduce the tension. Hopefully that will help if you have groin or inner thigh pain. Again, no more than 5 out of 10 pain level, or else you need to check your form, make a change to the amount of exertion that you're doing. And down. And pulling up that knee, 1, 2, 3, and halfway down. Keeping in mind that it's a very small motion. If it becomes too big, we will roll. So be very careful that you're not rolling on that right weight-bearing hip as you pull up the left knee and down. Feeling very steady. We do have some tension, like we're taking that tummy punch tension to help stabilize us. And halfway down, feeling lots of work on the side of the hip. We want to minimize and avoid as much muscle work in the front of the hip. So having the knees back is important here. Lifting up the knee, just that small motion, keeping the left hip into the left hand and down. We've got 2 more. Pulling up and down halfway. Last one. If you have no pain or very little, trying to get that knee up as high as you can, keeping your left hip forward and down. Okay, rolling over onto hands and knees. Let's get this band up to our hips. Okay, use your chair if you need to get yourself up properly, bringing the left or whatever foot is comfortable for you forward enough so your knee is stacked over your ankle. Always the right way to get up. Okay, pressing into that heel firmly. The back toes are flexed under if that's comfortable. Pressing down into your palms, whether it's on your leg or on the chair. Push hard into the front heel. What we don't want to do is let that knee ever come forward. So you're using the power of your legs and your glutes to push you straight up. Okay, to push you straight up. Okay, once we're up and all wiggled out, I'm going to get that band down to the ankles. Now we're going to move into the side leg pulls. It's the weight-bearing leg that we are most concerned about. If this bothers your knee, bring the band up to your knee level. Can be adding a lot more torsion than what your knee is comfortable with right now. So hand on a surface. I'm just going to use this here, give you this view. So the weight-bearing heel, in this case, I'm starting on my left. Left heel presses firm into the floor as we bring out the right leg and then return in. This is a 1 second pull out into the left heel and pull out. I'll show you this view now. Transfer the weight to the left side and then pull out. We're trying to make sure that the left hip does not go out to the side. That is the one objective we want to accomplish here. Into the left heel, keeping that left hip under you and over the foot as you pull out. Equal weight bearing. Transfer to the left heel, keeping the left hip under as you pull out. You might like your left hand on the side of your left hip as you transfer weight and pull. Kind of gives you a feeling if you're keeping that hip in the right spot. Okay, again, holding onto a surface as you transfer weight to the left, pulling out for a second, and we have one more. And the pull is not to meet a lot of resistance. I don't want you pulling with the almighty force. We're working on controlling this side. Okay, give that a little wiggle out. Other side. So whichever hand you wish, holding a surface. We're shifting to the right foot. So perhaps the right hand stays on the side of your hip. Left hand gives you some support. Pulling out the left leg, keeping that right hip under your rib cage. Equal weight bearing. Right heel presses, pull out. Equal weight bearing. Right heel presses to keep the right hip under you. Equal weight bearing. I'm not going to be too fussy if the shoulders lean too much for this week. We'll address that later as we build better core stability. I'll give you this view. Shifting weight, keeping that right hip where we want it, and pulling out. Equal weight bearing. Shifting, keeping the hip under you, equal weight bearing. One more, shift and pull out. And really we're feeling this, yes, on both sides of the glutes now that we're done, but it's that weight bearing heel. You can feel that glute contraction, this one, and that's what we want to keep on as we're shifting over to build that stability of the hip, which also affects your knee. Okay, let's get rid of that band. We're done. We're going to practice our hip hinging without our back becoming involved. So hand on the low back, hand on the tummy. Legs remain straight, feet comfortably apart. Where your hand is on your tummy, your lower fingers, I want you to feel the length that you're creating. A little bit of lower abdominal muscle activation right now. Feeling long, starting from your pelvic floor through the body. Keeping that length as you push your hips straight back and straight forward. The knees are not bending here for just a moment. Pushing the hips straight back. Your hand on your low back is making sure that you do not arch your back, which is sticking out your buttocks. Making sure you are not rounding your back and dropping your chest. So if I give you another visual, think about the shirt that you're wearing right now is not going to crease, which would create the bending. We don't want to have any creasing of the shirt. One more, repeat like this. Okay, this time we're going into a knee bend. So the hinge first, keeping very long, no shirt creases. Sitting the hips down just a small distance, looking at your knees. The knees are behind the toes. Press into your heels. Bring your hips forward, always to finish. Hips back. Sitting down into your hips. The weight is in your heels. Your torso is lengthened. Knees are behind the toes. Press into the heels and bring your hips forward just like when we finish the hip hinge. Hips back, no movement of the trunk. Sitting down into your hips and into the heels. Looking at your knees. Now this time we want to make sure that our knees are not toward the little toes or the big toe. Press into the heels. Bring your hips forward. Arms are in front this time. Hips go back. No movement of the torso. Sitting down just a small distance. Always checking knee position. Press up, bringing hips forward. Hips back. Watch your knees. Looking at your knees as you sit down. The knees are not towards the little toes or the big toes. Pressing up. Again, watching your knees as you come into the bend, making sure that they bend, staying over the ankle, over the midfoot, pressing through the heels to come up. Pain level, check, making sure that you're not going too far. If pain is up toward a 5 out of 10. And one more, as we push the hips back without moving the torso, Sitting into the hips and heels, watching those knees bend, pressing through the heels to bring the hips forward. Okay, give everything a wiggle out. We're going to move on. Now this time, after we've gone down into the bend of the knees, that little, just a small squat, never too far for now, we're going to take a step out with the right foot. So that left weight-bearing leg is our focus. The knee belongs over the midfoot, so not towards the big toe, not towards the little toe. The knee is also behind the toes, so centered over the mid of your foot, locked in place. And how do we accomplish that? We push into our heel, push down from the hip through your heel as you then step out, stepping in, come up and bring the hips forward, the rest of our hinge. Here we go. Hinge back. We're going to do the other leg now. Into the right heel, pressing from the right hip into that heel, very locked in place here. As we step out with the left foot, just a small distance. Step in, push through the heels to come up and bring your hips forward. Hinge back, no movement of the torso. Sit into the hips, watching the knees. Left side, pressing through that heel as we step out and in and up, hips come forward. Hinge back, I'll give you this view. Keeping the hips well behind the heels. You feel the weight in your heels onto the right side now, locked in place strongly. Stepping a small distance out, watching your right knee, stepping in, pressing through the heels to bring the hips forward. Hips back, down into the hips and heels. Watch that left knee as you press firmly from your left hip through the left heel, stepping out and in, and hips come forward. Hinge back. Watching your knees as you come down into the bend, they stay over the midfoot. Weight is into the right side, into the heel strongly, stepping out, stepping in. Press through the heels to come up, hips forward. Hinge, back, down. Weighted through that left heel. This is our last one on each side. Pressing through the heels to come up. If you're more than a 5 out of 10, check your movement. Watching the knees as you go down slowly is the key. Weighted through that side, right side, as we step out and step in. If you find it's too difficult to control one side, make sure you get some hand support next time and try it again. Maybe pause the video or do it later today. Okay, let's move on. Grab your chair. We're going to work on some function, sitting to standing. So I'm going to grab my chair, put it this way actually for you to see the profile. You get your chair, pause the video if you need. Okay, heels are somewhat close to the back of the chair so we don't miss it. Arms are out in front. We have length from the core, the pelvic floor, all the way through. Make sure you keep that length, no shirt creasing as you hinge. Now we're 4 seconds to sit down. 3, 2, 1, and now you can sit. Press hard into your heels to bring you up and push the hips forward. Now, if you are struggling with sitting down and you plop, or it's bringing that pain up to 5 or more, get an extra riser, an extra pillow under your chair. I'm going to take this one away. Okay, watching our knees now as we go back and sitting down. 4, watch the knees, they're in the right place. 3, 2, and 1 to sit. Press hard through the heels to bring the hips forward. Back we go, no shirt creasing. Sitting down. 4, 3, watching the knees, and 1. Press hard into your heels to bring you up, finishing with the hips forward. Hinge, keeping long through the body, no shirt creasing. Slowly sitting down to sit. And press into the heels to come up.
So one of the things about sitting is we will see that the knees go over the toes. They're just over the toes, but not ahead of. But it is easy as we sit down to bring the knees more ahead of the toes, especially the lower we go. So we want to make sure as we begin the hinge that we're sitting back into our hips and heels, feeling the weight through the heels. If the knees are coming forward too much, it might bother you, but if you can't stop that from happening, get a lift on your chair so you don't have to work so hard until the strength improves. Pushing through the heels. Last one, sitting back and down, 4, watching the knees, keeping the hips back, and sitting. Well done. We're going to come up, pressing through the heels. Okay. Last one we're going to do is some step backs. Now we were on the wooden blocks in the class, but we're going to do a little bit of stepping back just on the flat floor. So the weight-bearing leg is our focus, pressing into that heel. Keeping very long, maybe the left hand is staying on the left side of your hip to avoid this, okay, which then the knee turns in. Use some support. It can be a chair, it could be a countertop beside you. Now you want to step back, which is bending that left knee. It's just a small step. Keeping that left hip under your body and not letting it go out here. The moment it goes out here, you're going to feel more wobbly or it may bother hip or knee. So make sure that hip is, I'm even wobbly with it out there. Get that hip under you. Press into the heel, of course, you know that by now. Press into the heel to bring you up to standing on the 2 feet. Always returning that hip forward. That's the finish of your hinge. Okay, onto the left foot. Keeping weight into that left heel. Pushing the hip back into your hinge. Watch your left knee that it stays over the midfoot. You know the hip is under you. Press into the heel to bring you up. Feet together. I'll give you a side view. Onto the left foot, into the heel, hip back, watch your knee. Hip stays under you as you take a small step back. Press hard into the left heel to bring your hip forward. Feet together. Left weight bearing into that heel. Watch the knee, keeping this hip under you as you step back. Slight bend, just slight pushing into the left heel to come up. And one more. Stepping back as we hinge first, my apology. Keeping that left hip under you. If you feel wobbly, try and tuck that left hip under you. Press into the heel. And I want to give you this view just to watch. You can follow along if you wish. When you're on that left side, as we step back, it's very easy if the strength is not there for the hip to go out here. And you will feel much more wobbly. So hip is under as you press into the heel. Keep pushing into the heel as you take that small step back. Okay, the other side. So you get the idea. It's that weight-bearing heel press is critical. Onto the right heel, right hand on the side of your hip. Taking the step back, keeping that hip under you, and pressing into that heel to come up. Bringing the hip forward to finish. Equal weight bearing. Into the right heel. Hinge straight back. Step a small step. Press into that heel to come up, bringing the hip forward. We're intentionally moving slow. If you're moving too fast, faster than me, slow it down. Onto the right heel, pushing firmly. Right hip goes straight back, taking that small step. Knee positioning, always watching, pressing into the heel to come up. I'm going to give you this view. Follow along with me. Right heel pressing firm. You can feel the glute muscle. Keeping that hip under you, pressing into the heel as you take a small step. Pressing into the heel to come up and equal weight bearing. Right heel pressing as we hinge straight back, step. Keeping that hip under you as we press into the heel. Now watch this, follow along. If you take that step back with your hinge, if your hinge goes this way with your buttocks, I'm twisting my pelvis, my hip has gone this way. I want to make sure that my hinge goes straight back and not over here, which brings my knee in. So be aware, feeling what your body is doing at that hip, straight back, taking that small step, pressing into the heel and bringing the hip forward, and there we have it. So wiggle that all out. By now you should feel quite a bit in your buttocks. Pain score never more than 5, or else take a look at how you're doing it or make the movement smaller or add more hand support. Okay, let's pay attention to some walking for a minute here. When we're walking, we're into the heel, walking forward. So knowing that every step we take as the heel is approaching the floor, we're into the heel. Now you can drive yourself crazy if you think about this all the time, and I wouldn't expect you to. But as you're walking occasionally through your day, taking little moments of time, which could be just a minute or 2 or 3, doesn't have to be much, to think about as the heel approaches the ground that you're wading into the heel, getting the weight into the heel as your heel is approaching. Your brain is very smart. It knows to activate that glute muscle. If you're thinking about it, it's going to do it. So wading into the heel, taking a hallway at home, and get into the heel, into the heel, into the heel, into the heel. And by no means do we have to be very heavy pounders when we're walking with an extreme toe up, kind of like that. But we just are mindful of that heel is, we're wading into it. We're pressing into the heel as we're approaching the ground, into the heel. And that is one way to really train that neuromuscular control. Saying it over and over and over to yourself for that 2 or 3 minutes that you're going to walk down the hallway or walk from your vehicle into wherever you're going. Into the heel, into the heel, into the heel, into the heel. Feeling like every step you take, you are stable as best as you can be on the side without the hip swinging out into the heel. And the same thing goes now for backward walking. It is into the heel. So the toes touch down first, of course, and then we're into the heel. Toes touch down first, into the heel. And it's the same principle of keeping that hip in the right spot. So I encourage you through your day to practice 2-3 minutes of just walking forward into the heel and walking backward, thinking and saying into the heel. Okay, we're going to do one final stretch like we did in our class. No, we don't need that. We're going to get our hands up on the wall against a kitchen counter, a table, whatever you have that's nearby. Right leg is back, left foot is forward so that the left knee is over the heel or over the foot. Don't want the left knee ahead of the toes, okay? So we're pushing the right heel into the ground, and that right leg does not need to be back very far. We want to tuck the tailbone under as we press into that right heel, feeling the right buttocks on, tucked under, really kind of tightening up the core and tucking the tailbone under. Bring your body up long through the torso, and hopefully you can feel some pulling in the front. You may not feel much pulling if you're leaning over. So do your tuck under first so there's no strain on the lower back. Squeezing that buttocks as you press into the heel. And then just do what you can to lengthen and straighten through the torso. Don't create any stress. If you feel stress on your lower spine, then lean forward just a tad to unload that area and tuck your tailbone under. Keep pressing hard into that heel. And I want you to lift that heel up, the right heel, and put it down on the ground and press the heel again, tucking the tailbone under, trying to stay up as long as you can without low back strain. Lift up the right heel, put it down, press into the heel to turn on the glute, tuck the tailbone under. And last one, lifting the heel, Put it down, tuck the tailbone under, staying up as long as you can. And we'll go to the other side. So left leg is back straight, not too far back. Right knee is just over the foot, not ahead of your toes. Push hard into the left heel, squeezing that buttocks, tucking under. And hopefully you can feel that. I can feel that in the front of the left hip. If you don't feel that, you got some options. You can try and tuck more and squeeze more. Bring yourself upright. If you still don't feel it and you have no low back strain, you can wiggle that left foot back just a fraction. But really it's the tuck under, the squeeze of the buttocks, and the length, upright length of the torso to achieve that pulling in the hip flexor. Okay, lifting the left heel, putting it down, press into the heel to squeeze the glute, really work tight in there. Tucked under, lifting the heel, put it down, keeping tucked under, strong squeeze of the glute, upright through the body. Lift. If this bothers your knee, putting your heel down now and tucked under. If it bothers your knee, and it might very well, then we'll talk further next week about how to get a better hip flexor stretch. All right, you did a good job. Be mindful for today and the rest of this week where your knee is. Sitting down to the toilet, down to a vehicle seat, anytime you sit down, when you lunge down to get something low down, keeping that knee not towards the little toe, but right over the middle of the foot. Watch your knee. Pay attention to coming up as you drive through the heel. You did good to be with me. It takes effort, and that's what we're going to do together. See you next week.